One of the most common fears among older adults is not death. It is losing their memory. It is forgetting their address, not recognizing the people they love, losing the ability to manage the basic tasks of daily life. Dementia is a word that carries enormous weight, and for good reason. It is a condition that does not just affect the person who has it. It reshapes the lives of everyone around them. But here is what most people do not realize. While genetics and age play a role, research increasingly shows that a significant portion of dementia risk is tied to everyday lifestyle habits. Habits that are completely modifiable. Things you are doing or not doing right now that are quietly influencing the long-term health of your brain. Dr. Christina Prather, Director of the Division of Geriatrics and Palliative Medicine at George Washington University School of Medicine, puts it plainly. For many of us, we can make changes to our lifestyle and know confidently that we have done everything we can to prevent this. Today we are going through all 8 of the habits that experts say could be raising your risk and exactly what to do instead. The first habit is ignoring the impact of food on your brain. Dr. Rudy Tanzi, Director of the McCants Center for Brain Health at Massachusetts General Hospital, offers a framework that makes this simple. What is good for the heart is good for the brain. The same dietary patterns that protect your cardiovascular system also protect your cognitive function. The Mediterranean diet, which is rich in healthy fats, lean proteins, whole grains, fruits, and vegetables, is one of the most well-studied eating patterns for brain health. The Mind diet builds on this by specifically emphasizing foods with the strongest brain protective evidence, including whole grains, beans, berries, leafy greens, fish, and olive oil. Both diets work by reducing inflammation, supporting vascular health, and providing the nutrients the brain needs to function and repair itself over time. Neglecting your diet is not a neutral choice. It is a choice that accumulates consequences over decades. The second habit is not managing your existing health conditions. Diabetes, high blood pressure, and high cholesterol are not just cardiovascular concerns. They are established dementia risk factors. Dr. Prather says that aggressively managing these conditions is one of the most well-established ways of reducing the risk of cognitive decline and dementia in the future. Dr. James Ellison, a geriatric psychiatrist at Jefferson Health, adds that vascular risk factors like atrial fibrillation, high blood pressure, and elevated blood lipids are particularly important because they directly compromise circulation, blood supply, and oxygen delivery to the brain. Vascular dementia, which occurs when blood flow to the brain is reduced or blocked, is one of the most common forms of the condition, and it is heavily influenced by how well these conditions are managed over time. The third habit is not getting enough restorative sleep. This one is more serious than most people appreciate. Dr. Ellison explains that the brain renews itself during deep sleep and clears its concentration of beta amyloid, the toxic protein most closely associated with the development of Alzheimer's disease. Without adequate deep sleep, this clearing process is disrupted and beta amyloid accumulates. Prather adds that undiagnosed sleep apnea is an epidemic among older adults and results in chronically poor quality sleep that the person may not even be aware of. Medications that induce sleep can also interfere with the restorative stages the brain needs most. If you are not waking up feeling genuinely rested, that is not a minor inconvenience. It is a signal worth taking seriously and discussing with a doctor. The fourth habit is neglecting your social connections. This one surprises people, but the research is consistent. Loneliness, depression, and social isolation are exceptionally damaging to cognitive health. Dr. Ellison points out that loneliness among older adults carries a mortality risk comparable to moderate smoking. That is not a metaphor. That is a documented health outcome. Dr. Prather explains that staying socially engaged keeps you cognitively engaged, whether through conversations, listening to stories, participating in group activities, or simply maintaining regular contact with people who matter to you. The brain is stimulated by social interaction in ways that other activities do not fully replicate, and chronic isolation creates conditions in which cognitive decline accelerates. The fifth habit is drinking too much alcohol. Dr. Prather is direct on this point. If someone comes to her with concerns about their memory or cognition, one of the first things she tells them is to reduce their alcohol use. Alcohol is a direct neurotoxin. It increasingly appears to raise the risk of almost all cancers. And critically for dementia risk, it severely disrupts sleep quality, which, as we just discussed, is one of the most important factors for brain health. After age 65, the recommendation is no more than 1 standard drink per day and no more than 7 per week. The liver ages just like every other organ, and the body's ability to process alcohol decreases significantly with age. What felt manageable at 35 is genuinely damaging at 65, in ways the body often does not make immediately obvious. The 6th habit is skipping exercise. Dr. Ellison recommends that older adults aim for 30 minutes of aerobic exercise 5 days a week. He also notes, with some concern, that only about 10% of adults over 75 actually meet that level of activity. Exercise benefits the brain through multiple pathways simultaneously. It improves cardiovascular health, which directly supports blood flow and oxygen delivery to the brain. It reduces inflammation. It supports mood and sleep quality, and it appears to directly stimulate the growth of new neural connections. Dr. Prather emphasizes that fitness is something to prioritize well before any cognitive changes begin. Waiting until decline is noticeable is waiting too long. The protective benefits of regular exercise are cumulative and require years of consistent practice to fully develop. The 7th habit is not wearing a helmet. This one is specific but important. Dr. Victor Henderson, director of the NIH Stanford Alzheimer's Disease Research Center, says he tells his patients clearly, if you are bicycling, wear a helmet. The research linking head injuries to dementia is substantial, spanning a large number of observational studies. At the population level, the contribution may be modest, but at the individual level, a single significant head injury can meaningfully increase a person's dementia risk in ways that are entirely preventable. Helmets, fall prevention strategies, and general awareness of head injury risk are simple protective measures that should not be overlooked. The 8th habit is ignoring depressive symptoms. Dr. Ellison, speaking as a psychiatrist, makes a point of including depression on this list. Even low-grade depressive symptoms that do not meet the threshold for a clinical diagnosis can quietly erode the behaviors most protective against dementia. Depression disrupts sleep, it reduces motivation to exercise, it leads to social withdrawal, it affects diet, it essentially undermines every other item on this list simultaneously. Treating depression, whether through therapy, medication, or lifestyle intervention, is not just about mental health in isolation. It is about preserving the full ecosystem of habits that protect cognitive function over time. The broader message from the experts is one of both urgency and genuine hope. Dementia rates are actually declining slightly when adjusted for age, and researchers believe this is at least partly due to improvements in cardiovascular care and lifestyle habits across the population. There are also now FDA-approved medications for the most common form of dementia. But the earlier these issues are addressed, both medically and through lifestyle, the better the outcomes. None of this means that everyone who develops dementia failed to take care of themselves. Genetics and unmodifiable risk factors are real, and Dr. Prather is clear that blaming people for their diagnosis is not fair or accurate. But for many of us, the choices we make today about food, sleep, exercise, alcohol, social connection, and medical management are shaping the brain we will have in our 70s and beyond. If this video gave you something actionable, share it with someone you care about. And subscribe for more content on brain health and healthy aging that gives you real information you can use.